Hi everyone, Dr. Nemechek here. I have a request recently. Somebody asked to just talk about the improvements that can happen with older uh, patients with autism. And so I want to use this case. This is a boy named Peter, and he started here at 27. That's when he started on the protocol. Peter was originally diagnosed with recessive autism at 2 years of age, really for most of his life. Very minimal speech, very poor comprehension, needed a lot of prompting for just simple commands, things like that. Had some trouble with constipation and reflux, but overall, the biggest issue was just extreme aggression and self-injuries. He had been tried on many antipsychotic drugs, and according to the parents, just real bad side effects from all of those. So we start him on basic protocol. We use fish oil, olive oil. We started him at vagal stimulation because most kids at this age need vagal stimulation to get progress. 5 minutes a day. We use the Vitality Smart Cable, and then we put him on monthly rifaximin. So he's getting 550 milligrams twice a day for just 10 days each month. So like the 1st through the 10th of every month. Okay. You send him off. He comes back 4 months and the follow-up, and parents are like, wow, he's like understanding a lot more. He's speaking more and often without prompting. The aggression is beginning to decline. It was bad episodes 2 to 3 times a day. But what they notice, so he gets the medicine from the 1st through the 10th of every month. Before the month is over, in that last week, they start seeing him deteriorate and do worse again. And so that's a sign that you have relapsing. And the vast majority of kids, they're going to relapse if you're just doing monthly rifaximin, the kids with autism. So we moved him up to continuous, so 550 milligrams twice a day, nonstop. And this is a common way that rifaximin is used in a condition called hepatic encephalopathy. It's very safe, very few side effects, doesn't get in the bloodstream, doesn't cause resistance to the drug, doesn't damage the biome, it's safe to do. And so we follow up here every 4 months. So after an additional 8 months, so he's been on that continuous for 8 months. When I'm looking at the notes, at that point, I have in quotes the parents saying that he is almost a completely different person. Language is continually improved, no prompting required, starting to ask questions. Some components you might interpret as almost like a conversation, but albeit limited still. And the aggression had almost completely vanished. Again, 2 or 3 aggressive, extremely aggressive episodes per day is now reduced to 1 episode maybe every 2 to 3 weeks, and it's relatively mild and much shorter at that. So the point of this is that nobody thinks these kids can do better. These autistic kids, really, after 8-10 years, they're basically put out to pasture by the neurology and autism, treating physicians, because they've been all told you can't recover. Look what happens. You can recover, and but nobody recovers if you don't try. Okay, now the driving force behind autism. And it's becoming quite clear, and it's not even just behind autism, it's behind most chronic neurological conditions we now know is an imbalance of the intestinal tract. Okay, this is a normal setup. Stomach flows in the small intestine and large intestine. We have certain species that live in the small intestine, other species that live in the large intestine. And basically what you have that's triggering autism is you have some otherwise normal bacteria just living in the wrong spot. Okay. When this happens in adults, it's typically, you have about 1,000 species here. In adults, it's typically one, maybe two species are living abnormally in the small intestine. It's probably going to be the same thing in autism. This causes a massive amount of leaky gut and large inflammatory stress. And the reason why you get so much inflammation is 70%, 70% of all your white blood cells are wrapped around the small intestine. And when you leak through, big inflammatory reaction that prevents the brain from functioning correctly. And it prevents the brain from pruning itself, repairing itself, and so forth. Okay, you've got to fix this or nobody gets better. And that's where this is the only thing rifaximin can do. It's the only thing it can do is fix SIBO. Okay, so if you use rifaximin and you get a positive response, you had SIBO. Okay, it's more accurate than any test you can do, any of these breath tests or anything. Okay, and for those of you who are interested, you can get our starter pack. So it comes with a book. We got our fish oil, olive oil, and for the younger kids, inulin. Now, once you start getting up through the teens, the inulin's less effective and you need rifaximin. So in that, you're going to need a physician's assistance to help you get that medicine. So I hope that's helpful. I think all these kids have the potential to recover. And we just have to keep pushing. We can't accept no for an answer. Unfortunately, with bacterial overgrowth is now being understood to be part of like Alzheimer's and Parkinson's and multiple sclerosis, and there's more and more research being done on this, and if they can find better ways to control bacterial overgrowth and stop the leaky gut, say in Alzheimer's, it's going to be useful in autism. So we just got to keep pushing. All right? Okay, that's all for now. Keep your heads up. Have a good day.